Welcome back, everyone. January is Cervical Health Awareness Month, a time for women to not only take stock of their personal health, but also highlight the importance of the HPV vaccination, which helps prevent certain cancers. Here to tell us more is Dr. Paul Mayer from Kaiser Permanente. Thank you so much for being here. Such an important topic.
Absolutely. Thank you so much for having me.
Of course. Well, let's first talk about and establish why cervical health has really become so prominent over the last few years.
Absolutely. So cervical cancer is a highly preventable cancer, something that we have a great screening tool and actually a great vaccine now that can prevent folks from getting cervical cancer. So cervical cancer and awareness about cervical health is just really important for women. So
yeah, exactly. And I know that these screenings, as you mentioned, so important, and receiving the vaccine important as well. So talk more about that.
Yeah, so we've developed a cervical cancer screening tool that's really been around since the 1950s and has really helped reduce the number of cervical cancer cases in the United States drastically. And that's the pap smear, which a lot of women are familiar with. But the HPV vaccine is also another tool that we have to help prevent cervical cancer that's really been developed in the last 20 to 30 years. And cervical cancer in and of itself is related to HPV. So getting the vaccine can really prevent you from developing cervical cancer.
Okay, now just to put it in layman's terms for us, what is HPV?
HPV it stands for the human papillomavirus. And what that is a family of viruses. It's more than actually just one. There are over 100 strains of HPV.
Wow.
And so HPV has been linked to 99.7% of all cervical cancers, and so taking the vaccine can really prevent folks from developing these cancers.
And what other illnesses does the HPV vaccine actually help protect us against?
So the currently available HPV vaccine in the United States actually prevents against multiple different types of cancers, specifically cervical, but also other anogenital cancers, mouth and throat cancers, as well as genital warts. So it's a really important vaccine. Okay,
and I know when I go get my daughters, I have two, 14 and 12, and I think it was when she was 12, my oldest, that they started talking about, you know, that it was time. So, but the important thing that I want to make mention of is that you say it's not just women and girls, but boys should get it as well, starting about that age?
Absolutely, yeah. So HPV is common in the United States population. Really, all sexually active individuals are exposed to HPV. And so the vaccine is for both boys and girls, and it really helps prevent the spread of HPV in the population.
Right, and was that about the right age?
Yeah, age 9 to 14 is typically the recommended age, really ideally before you're exposed to HPV.
Got it. Okay, that makes sense. And a series of shots, right? I know there's 2, or is there even more?
Depends on your age. So if you start the dose between 9 and 14, you really only need 2 doses. But if you get the vaccine after the age of 14, it's a 3-shot series. Okay,
and that was going to be my next question, because experts recommend the age that you just said. But if you are age maybe 27 to 45 and you haven't been, should you still get vaccinated?
Absolutely. Yeah, the vaccine's been FDA approved now up to the age of 45. And so it's a 3-shot series. If you get the shot after the age of 15, like I said, it's a shot followed by another one at 2 months, and then a 3rd dose at 6 months.
Okay, makes sense. And quickly, you mentioned about the pap smear. I know that it seems like, I don't know, for a while I thought as an adult woman I was getting it every year, but now I don't. It seems like it doesn't need to happen every year. Is that correct?
Yeah, and that's part of the confusion I think that's out there now, is that you're not getting your pap smear every year anymore, because we've incorporated another screening modality for patients, another screening tool, which is testing HPV on the pap smear sample.
Right.
I think the most important thing for everybody to remember is just getting to your doctor once a year and letting your doctor have a conversation with you about whether or not pap smear testing is needed.
Yeah, it's so true. Thank you so much, Doctor.
Absolutely.
This is such an important topic. We appreciate your time and your great insight. And we'd like to thank Kaiser Permanente for sponsoring that important segment.